Queen Elizabeth II and her husband Prince Philip received their COVID-19 vaccinations on Saturday as UK continues to speed up their mass vaccination drive amid surge in COVID-19 infections in the country. The 94-year-old monarch and 99-year-old Prince Philip were given the injections by a royal household doctor at Windsor Castle. According to sources, the decision to let it be known that they had been given the vaccine was made personally by the Queen in order to prevent speculation. The Queen and her husband have spent much of the pandemic in self-isolation because of their age, which keeps them in the high-risk zone. Britain is currently witnessing a massive surge in COVID-19 infections, and authorities have been blaming the new coronavirus variant for the recent spike in cases. Britain on Friday reported a record 1,325 deaths in the last 24 hours as the surge in cases piled more pressure on overstretched health services in the country. On Saturday, the government reported another 1,000 deaths from COVID-19, bringing the country's total death toll to over 80,000.
So at the moment, our intensive care unit is way over capacity. The staffing is very, very sketchy. We're doing our best, but it is, it's essential that people abide by the rules so that we can provide the care to the community.
The UK government on Saturday launched a countrywide public information campaign in an effort to improve adherence to COVID lockdown restrictions. Chief Medical Officer led the campaign with advertisements on social media telling people to act as if they already had the virus. England then went into its third nationwide lockdown on Monday with an order for the public to stay at home unless they need to leave the house for essential reasons such as shopping or essential work. Meanwhile, the Mayor of London, Sadiq Khan, has also declared a major incident in the city on Friday as the recent surge in cases threatened to overwhelm hospitals, with around 1 in 30 Londoners estimated to be infected with the virus. And for more on this, London Bureau Chief Mandy Clark is joining us live from London. Mandy, thank you so much for joining us. What can you tell us about the situation on ground right now?
Well, yes, it's fantastic news that the vaccine rollout is happening. Of course, the Queen made a point of announcing it. Normally, they keep their health very private. They don't make announcements of their personal health. But the point the Queen was trying to make was a message to the anti-vaxxers, that she wanted to make it clear that she believed it was safe. And that's why they made that public announcement. And we are starting to see the rollout reach that top tier, those vulnerable people, which the top tier, the Queen was included in, those 90-year-olds, plus 90-year-olds. So that's the one bit of good news. But of course, in London right now, the death count is going higher. The cases are going even higher. Even though the lockdown has happened, we haven't seen the effects of the lockdown yet. And just yesterday, they had COVID marshals on the streets, certainly here in southwest London. These COVID marshals are enforcing the rules. We are noticing a level of COVID fatigue. People are tired of it. We're noticing that there is more willing to break the rules. That's a step change from a year ago when the first lockdown took place. So there is a level of fatigue where we're seeing relapse. And that's why we're seeing stricter rules. We're seeing that new campaign and also marshals on the streets.
Yes, and also, as you know, as we mentioned earlier, a major incident has been declared in London. How do you think that's going to impact the everyday life of people and also the immunization program, if it will have any impact at all on that?
Really, the major incident is those hospitals, the overwhelming of hospitals, those frontline hospitals, and the fatigue also speaks to the doctors. There's one doctor I know who works in a frontline hospital, and she says that the doctors have been at it for a year. They are exhausted, and there's simply no soldiers. If they were frontline military, there's no soldiers giving them resupplies. So there's a level of exhaustion even amongst medical care, and they are seeing numbers that are much, much greater than the first time around. So that's where we're seeing that enormous pressure. But the vaccine rollout so far has been very effective at getting it out. And I think that's currently the government's priority, is to have the vaccine rollout happen as quickly as possible to start dampening down those numbers. But certainly it doesn't seem like the hospitals will get any better before that gets worse, because only in like a week and a bit we will see any benefit from Tier 5 that London is in. So I think it's a case of going through COVID patients right now have to wait 40 minutes outside of hospital. I know some places in London, and some are being sent to other counties because those hospitals simply can't cope, and there doesn't seem to be any more backup.
All right, Mandy, thank you so much for joining us with all those details.